letters on red background appear better, which can be darker, clearer, any way the patient can say. All right. So now you see the test is positive. The patient is saying that the letters on one specific background, that the red background, they appear better. If they appear better on the red background, that means there is residual myopia. There is residual myopia. Residual myopia means what have you prescribed to the patient? You had prescribed -2, but that means you are not correct. That means the power may be -2.25 actually. Third answer that I can get from the patient is letters on green background are better. If the letters on green background are better, it would mean that I have residual hypermetropia. Hypermetropia means I need some plus power. I need some plus power means I've overcorrected. That means actually I need to go down to -1.75. I need to reduce the power because there is hypermetropia now. Are you getting my point? I've reduced the power too much, so I have made the power of the eye lesser. Lesser means I have turned it into hypermetropia. So there is residual hypermetropia. Am I making myself clear here? That is what we need to do. That is what we need to understand and be aware of when we are doing two. It is used to differentiate between two conditions. What are the conditions? Cataract and glaucoma. Okay. In both cataract and glaucoma, the two conditions, patient complains of seeing halos around light. The patient is complaining of seeing halos around light. Halos means rings, colored rings. The patient says, I can see a bulb, but along the bulb or along the source of light, I see some colored rings. Now, these can be seen in both cataract and glaucoma. So, how do we differentiate between these halos? Okay. So, stenope in front of the eye is kept and rotated. If after rotating of the stenopaque slit, if halos appear broken means, let's say these are the halos. This was the source of the light in the center. These are the halos. If these are the halos, the patient will report seeing them broken like this. Okay. That means the diagnosis will be cataract. But if halos remain intact, then it will be a case of angle closure glaucoma. Okay, which type of glaucoma specifically? Angle closure glaucoma. Halos do not break. Why do the halos break in cataract? Because of the specific orientation of the lens fibers. Okay, due to that, when you are passing a slit, there may be cataract in one of the orientation, either the visual axis or the equatorial axis. So due to that, the halos will appear broken. So my question to you, which of you should differentiate between cataract and glaucoma? All right. But what is the second MCQ? The exam we used to determine the meridian for optical iredectomy. Now, if you understand iredectomy just by the name, it is pretty easy. Otherwise, I'm going to draw a diagram for you and make you understand. Let's say this is my corneal eyes, and this is my pupil. Okay, all this is my iris, obviously now. All this which I am coloring with yellow color, this is my iris. Okay, I hope you understand the simple diagram that I made. Now there is a corneal opacity. This is the corneal opacity, let's say. Now, as you would be able to see, this corneal opacity is blocking majority of the pupillary area, due to which the vision of the patient is compromised. So we are saying, can we cut the iris in some certain position such that the vision of the patient will improve? I'm saying yes. So I keep a stenopaque slit in front of the patient's eye. I rotate it in whichever axis. Let's say when the stenopaque slit is placed like this, I see that the vision of the patient has improved further because now the patient is using only this area of the pupil. So I will create an iredectomy. In which area? I will create an iredectomy in this area, so that the pupil will now be basically shaped like this. So that after the iredectomy, the light going through this area will multiply and the patient will be able to have a benefit. So I'm determining the meridian of optical iredectomy. I hope you understand.